Knee arthritis. Let's talk about it. So arthritis is inflammation of one or more joints. We will just use this simple definition for now. And one of the causes of joint inflammation is cartilage destruction. So who is prone to arthritis? Women are more likely than men to suffer from arthritis. Also, the incidence increases after age 40. However, injuries, genetics, and medical conditions can cause it to occur earlier. So what are the signs and symptoms of knee arthritis? Now, there are a number of them, but of course, you may not experience all of them. It all depends on your individual situation and the severity of your condition. Now, generally speaking, arthritis can be mild, moderate, or severe, so the symptoms and their severity will vary. So, you may experience pain and difficulty while walking or climbing up and down stairs or ladders. For some, there may not be any pain while they are sitting, but as soon as they stand up, they experience pain. At times, there may be a grinding or locking sensation in the knee. Some people report the knee feels as if it is going to give out and they are going to fall. Sometimes crackling sounds are heard, but it is also quite normal to not have any arthritis and still hear those crackling sounds. Heat and swelling may occur when you have a flare-up of arthritis. Now, a flare-up can occur when you do an amount of physical work that is not typical for you. For example, cleaning around the holiday season. So what is the mechanism of knee arthritis? What can lead to this degeneration of cartilage? So within the knee joint, there is the thigh bone, shin bone, and kneecap, and these are covered by cartilage. There is also a separate piece of cartilage between the thigh bone and the shin bone called the meniscus. So the cartilage contributes to lubrication and cushioning of the knee joint when it bends and straightens, as well as when it needs to absorb impact, for example, landing after a jump. Now, in addition to the cartilage, there's also synovial fluid within the joint that also helps with the lubrication. This fluid is described as having the consistency of egg whites. In arthritis, the fluid can lose some of its consistency and become less effective. Now, when the cartilage gets worn away by various mechanisms, the lubrication and cushioning is reduced. This can lead to increased friction, pain, and swelling within the joint. Now, I mentioned the cartilage can be damaged by different mechanisms, so let's briefly discuss a few of them. Obesity. Now, being overweight will lead to additional loading forces on the knee joint, and over time will lead to excessive wear and tear of the cartilage. Injury. An injury or repetitive injuries, for example in athletes, can lead to arthritis. Also, an injury can cause a person to use the leg less than usual due to the pain. The degree of bending and straightening of the leg may also be reduced. This can lead to muscle weakness and stiffness, which can further lead to a weakened and unstable joint. The lack of strength and poor mechanics due to instability can lead to a degeneration of the cartilage and hence arthritis. This is because the muscles, tendons, and ligaments are not doing their fair share of load bearing, and the cartilage is now forced to deal with those excessive forces. Strength and range of motion need to be regained as quickly as possible. Also, an untreated knee can eventually lead to back pain and spinal problems as you develop a new walking pattern to compensate for a painful knee. Now let's talk about rheumatoid arthritis. This is an autoimmune condition. This means the body's own immune system attacks its own tissues. In this case, the synovial tissue is attacked. Remember, this membrane produces the synovial fluid, which helps with the lubrication of the knee joint as well as supplies nutrients to the joint. Another way in which cartilage can be damaged is by an infection in the knee joint. If the joint becomes infected with bacteria, viruses, or fungus, it may become hot, stiff, and painful. Now, if a person has knock knees or bow legs, the outer and inner cartilage respectively can be worn out due to greater forces because of the knee misalignments. So how is knee arthritis investigated and diagnosed? The knee x-ray is one of the main investigations, but depending on the severity and nature of your symptoms, medical history, and family history, a number of additional tests may be performed to come to a diagnosis. There may be other conditions other than arthritis that may be causing your joint pains. So an x-ray can show any reduced joint space within the knee that may point to a loss of cartilage. The x-ray may also show the presence of bone spurs and degeneration of the bone just below the cartilage. If the doctor needs to see soft tissue such as muscle, tendons, and ligaments in detail, an MRI can be done. This may be done if the person reports the knee is locking or giving out. Of course, if the doctor suspects your knee pain may be due to an underlying medical condition, blood tests may be ordered. So how do we treat knee arthritis? A good starting point for many early and mild cases would be weight loss, physiotherapy, pain medication, and possibly knee bracing for offloading of the knee. Additionally, underlying conditions such as diabetes and rheumatoid arthritis will need to be properly managed for you to benefit the most from your regimen. Now, injections directly into the knee joint can be done. 3 popular injections are steroid, platelet-rich plasma, and gel injections. The steroid injection can help to reduce inflammation within the joint. Platelet-rich plasma can be used to regrow cartilage to some degree in some cases. With this method, plasma is extracted from your own blood and injected into the knee. So when it comes to platelet-rich plasma, this is the process. Blood is extracted from your own arm or your own vein. Then it is put into a test tube. It is put into a centrifuge. It is spun down and it separates. That is injected into the knee to help with the possibility of cartilage regrowth. Also, a gel or hyaluronan injection made from chicken combs is another option. It aims to replenish the synovial fluid within the knee and increase the lubrication. So if you are allergic to chicken, this may not be for you. Then of course there is knee replacement surgery. Typically the lifespan of a knee replacement is 15 to 20 years, after which a revision needs to be done. To maximize the effectiveness of a knee replacement, some form of physiotherapy will need to be done after. This also applies to the knee injections as well. So feel free to contact us for more information. You can even WhatsApp your medical reports and scans to us and we will advise accordingly.
Call or WhatsApp us today at 747-5297 or 308-3370 to schedule your assessment and begin treatment.
You can tap the description below for all of our contact information.